My name is Chad Bishop. I live at 7405 South Valencia Drive here in Sioux Falls. I last addressed this body on August 24th, where I asked you to consider adding serological data in collaboration with the county and state to more accurately determine the number of COVID-19 recovered persons so that we can add them to the voluntarily vaccinated and better calculate our progress towards community immunity. I realize I said a lot in 5 minutes that evening. I would ask if any of it was inaccurate, misunderstood, or false. At that time, I pointed out Dr. Fauci stated he was not willing to say the number required for community immunity, not the voluntarily vaccinated campaign, but herd immunity was 90%. Last week, the president stated his vaccination target is now 97 to 98%. His vaccination target, not his target for community immunity. As recently as July 21st of 2021, the president stated, you're not going to get COVID if you have these vaccinations. Since my prior statement, we have seen analysis of the early Israeli data showing that the COVID-19 recovered are 13 times less likely to be reinfected, specifically with the Delta variant, than those receiving both doses of the Pfizer-BioNTech vaccine are to have a breakthrough infection. It would seem the serology data would serve to better inform our policymakers, such as yourselves, business leaders, and individual citizens if we had it. When questioned on CNN, even Dr. Fauci had to concede natural immunity had to be discussed seriously, having no firm answer when he asked to justify vaccination for the COVID-19 recovered. If the Israeli analysis proves out and natural immunity is broader and more durable than the conferred by the vaccines, one must ask and answer the following. If there's negligible benefit of the vaccination for COVID-19 recovered, is it unethical for us to not screen for seropositivity before administering it? In addition, shouldn't a COVID-19 recovered person be treated equally to the voluntarily vaccinated nationwide? If not, why not? Isn't this especially true when the portion of the population who is most at risk, not from infection, but from an adverse outcome or mortality, has had every opportunity to avail themselves of the vaccines and manage their own personal risk? I am sure we all understand we did things a little different here in South Dakota. Like the policy or not, we adhered to what was the World Health Organization's November 2019 recommendation for a respiratory flu pandemic that existed prior to the politicization and panic brought by Bruce Aylward and his WHO report on the CCP mitigation methods. Given that, is it reasonable to ask why our public officials and their public health experts, what is the seropositivity rate for South Dakota? What is it for Sioux Falls? Is it the 6.8% Sanford reported last July, the 20% nationwide as JAMA estimated this May, or is it the 36% the CDC published in July, or is it more? Why don't we know? Thank you.
Thanks, Chad. Anyone else for general public input tonight?